Hello, thank you for joining in. My name is Efe Okofasa, your financial advisor. And in this short video, I'm going to show you what we'll be going through when we have an appointment in place in creating the best cover for you and your family. Either you want to take on life insurance or income protection insurance or critical illness insurance. We are one of the best in the UK. And I'm so fortunate to be working with Tavistock Protect, where we work with individuals, professionals, and family who want to create the right premium and the right policy in place for them. So by the time we have booked a call, when we schedule a call, what I'll be showing you briefly, I'm going to take you through on this video. So when we have the one-on-one, you will have an opportunity to ask me any questions. So I'm going to start sharing the screen with you so we could see how we could take it from there. Hello there, my name is Efe Okofasa, and today I am your expert advisor where I will be taking you through some fact findings so that we can customize the best policy for you or and your family to make sure you are properly covered and you have the right premium in place so that you can live the rest of your life with peace of mind. So this process is something we're going to do by the time we book a consultation and be perhaps the reason you're watching this video, we've had a meeting or you've met with one of my team, and this is just an introduction to what we'll be doing during your meeting with me or with one of my member of staff. So the meeting is you're going to take about 30 to 40 minutes maximum. You're going to go to the fact finding so that we can have the right policy for you. So what I'm going to do now, I'm going to share the screen with you. All right. Okay, so this is where we are right now. So during our meeting, our one-on-one meeting, to make sure you have the right thing, we're going to put it into our system and we're going to look for the right product for you. So this is either you want to have a policy in place, life cover, critical illness cover, home insurance, income protection, private medical insurance, mortgage, pension, public liability, or employer's liability. It depends on where you are right now and what is the right fit for you and your family. So let's assume we are here now. This is going to say we're going to start application. So we're going to look from where. Let's go with the sample of an existing. Let's say it's a client. So what we're going to do. So we're going to look into your gender. We're going to ask you about your name. Blah 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 blah. Okay, so this is just a dummy quote. So we're going to look into this and help you to generate this thing. So this is where we are right now. So we're going to ask for your name, your gender, your date of birth, your age, your email address, and all those kind of address and your postcode. We're going to find get that. Then that will now take us to the next place. So we're going to look into which of the policy that is suitable for you with where you are right now. So either life insurance, critical illness cover, home insurance, income protection insurance, or something that's suitable for you. So after doing that, then we're going to look into now your preliminary data. So you're going to pick, I'm going to start all over again. Hey, thank you for stopping by. So this is what we'll be doing. We'll be looking into when you jump on a call with me or with a member of my staff, so that we make sure you have the right policy in place. So when we're on the call, this is something we're going to do quickly. I'm going to last for about 30 to 35 to 40 minutes to make sure we have the right policy for you. So we're going to ask you some questions that they say yes or no. Like life insurance, do you have life insurance right now? We're going to say no or yes. Critical illness insurance cover, you're going to say yes or no. home insurance. So we're going to ask you all those questions that demand yes or no. That's a permanent doctor. Then the next one is we're going to look into about you, which is your name, your surname, your gender, your date of birth, your age, your phone number, your workplace, and where you live, if you own a property or not, if you have a mortgage or not, how long you've been in the UK, and all that, all residency. So we'll look into that. Then that will not take us to your dependents. If you have dependent, that is, if you have a children or you have a wife, you're going to say yes or no. Whatever your situation is, we determine what we're going to click here. Then after that, we're going to look into your employment details. Your employment details, we're going to look into what is your occupation? What is your occupation status? Are you employed, self-employed? Do you employ others? If you're employed, what company are you employed with? Then for that, we're going to look into your income details. We're going to ask you for your gross annual income. How much do you earn? Because that will go a long way to determine what is the best fit for you and something you can afford with your current situation right now. So we're going to automatically put the number, and that will automatically be generated by our system to get the gross and the net pay. So after that, we're going to ask you if you have any, if you've been working for the last 12 months or less. You're going to say yes or no. And also, if you're employed, we're going to ask you if you work for 16 hours or more per week. Are you currently sign off sick? You're going to say yes or no. Are you entitled to company benefits in the event of being unable to work? You're going to say yes or no. Do you have an emergency fund available? You're going to say yes or no. Emergency fund is if you have any money saved somewhere that all of a sudden, if anything happens, you have something that you can fall back to for any eventuality that happen. So it's up to you. You're going to say yes or no. And also going to ask you your budget that you have available for your cover premium monthly payments. After that, we'll now go into your expenditure. You may wish to disclose your expenditure. You may wish not to disclose your expenditure. Depends on your circumstances. We're happy with that. Then after that, we'll now go into your mortgage details. Do you have a mortgage? You either say yes or no. If you have, we'll click yes. If you don't have, we're going to click no. That will determine what we're going to do moving forward from there. And also going to look into your pension details, which is, do you have an existing pension? It's either yes or no. And would you like an advisor to contact you to discuss your pension details? You can either say yes or no. So that's what we do then. Then your investment details. If you have investment, if you're happy to disclose it with us, it's fine. If you're not happy, it's also fine. So you're going to say yes or no when it comes to your investment details. Then we're going to look into your health details. So this one is very important. Do you smoke? You're going to say yes or no. Please select never smoke or ex-smoker. If you're a smoker, do you drink? You're going to say yes or no. Do you drink alcohol? You're going to say yes or no. We're going to say how many units per week do you drink if you say you drink. And also, what's your height? We're going to ask you for your height. What's your weight? We're going to ask you a question on that. I'm going to ask you, have you consulted a doctor or any medical practitioner in the last 5 years? You say yes or no. Do you have any pre-existing health condition? You're going to say yes or no. So all those is about your health condition, which will help us to make sure you have the right cover and policy in place. Then after that, we'll go to the information, your GP details. We want to know who is your GP so that we can contact them to make sure we have the right record of your health record in the last few years. So you're going to give it to us. And even if you don't have it during the call, as long as you can provide the name of your GP, the name of the practice, we will do all the other findings by ourselves. Right. So now we're going to look into the income protection. So do you currently have any cover in place in terms of your income protection? If you say yes or no, it will depend what we're going to do from there. So is the current taking income protection? We're going to say yes or no. If you haven't had income protection in place, we like talking to clients for them to see the importance of putting it in place as soon as possible. Then from there, we're not going to term insurance, which is a life insurance now. Do you currently have cover in place? In most cases, people say no. If maybe you have already, if you say yes, then we are here to review what you already have to make sure you are properly covered. If you're not properly covered, we'll advise you further. Then, is the client taking term assurance? In this case, we say yes. So now, when we have all this information, now it will now allow us to generate quotes. So let's assume we've taken all this information from you. Now this system will now ask us, we'll click on there, take us to our portal to be able to generate quote. So right now, this is where the quote now, we're going to generate quotes for you. Let's assume you want to look into your life insurance policy. So this is where it will come. I'm going to for you a level term first, which is for you premium type guaranteed. We're going to look into at what age do you want to cover to. In most cases, we'll advise people to cover themselves at least to the end of their retirement or above that. So retirement, I think, is about 67 years old. So in most cases, we advise our client to cover up to 70 to 75 years. Make sure they are properly covered, depending on the family circumstances or the children, how old they are. Okay, so the life income. So you're going to tell us how much you want to earn. Sometimes you could say, in the case of anything that they need to be paid out, you will say you want your family to be paid £200. It could be more or it could be less. But for now, let's put it on £200. So we'll put it there. They will not look into what term ROPI. So we'll now save it, generate quote. So now, with the information we've given to it, we'll now generate quote to get quotation from all the providers we have in the UK that we work with. So in these cases, with the information that I put, the premium is £21 2 pence per month. So we'll look into various provider, which is £21 per month. This is for Vitality Optimized Life Insurance, or this is Vitality Life Optimized Life Plus Child. So let's assume we pick one that suits your circumstances. So we click on it, and so we'll get the information here, we save it there, and that is what we have. So after that, if you want to do for income protection, we'll go through the same process as well to make sure you are properly covered. So these are the things we'll be finding out in our one-on-one consultation with you with the fact finding to make sure what we're offering you is something that's suitable for you, for your family, for your circumstances, that's affordable to make sure you are well protected and your family is well prepared for this. So if you haven't yet booked the time, the call, click on the link that we will send to you. Let's see how we can best cover you and put some protection in place for you and your family. I'll speak to you soon again.